over there and seeing your little world of infection control.
Come wash. I'll show you how I wash my hands.
Okay. Thank you very much, Tova. Bye.
This is Money Talk Radio, AM 740 WSBR Boca Raton and WPOW HD3, Miami, Fort Lauderdale.
Here's the latest from ABC News. I'm Dave Schreiber. Officials are trying to determine the exact number of people killed and what caused a small plane to crash in East Haven, Connecticut, a residential neighborhood a few blocks from a Connecticut airport on landing. Officials say between 4 and 6 people were killed Friday when the multi-engine propeller-driven plane hit 2 small homes near Tweed, New Haven Airport. The plane's fuselage had entered one of the homes. Connecticut's governor says rescuers spotted 2 bodies. The mayor of East Haven says a vigil is planned for Saturday night at a park.
Rescue workers are still searching the rubble for the bodies of 2 children and those on board the small private plane that nosedived, one of its wings slicing through an upstairs bedroom, where neighbors say a 1-year-old and a 13-year-old may have been.
ABC's Lindsay Janis. A rough night for police in Belfast city center, as ABC's Linda Alvin explains.
It got pretty nasty. Police trying to head off clashes between loyalist Protestants trying to prevent a march past by Catholic Republicans were pelted with rocks and bottles by the protesters. 26 officers were injured, 5 needed hospital treatment. Some loyalists accused the police of being heavy-handed and said the march had been designed to provoke a reaction. It was a reminder that while Northern Ireland has come a long way, the divisions are never far from the surface. Linda Albin, ABC News, London.
18 U.S. diplomatic outposts closed because of a terrorist threat will reopen Sunday, but the U.S. Embassy in Yemen will remain closed. The State Department cites ongoing concerns about potential terrorist attacks by al-Qaeda in the Arabian Peninsula for keeping the embassy shut. The search for 16-year-old Hannah Anderson and her suspected abductor is focused on a sprawling wilderness area in central Idaho. This is ABC News.
When you want to know what the best product is, you ask an expert. So if you want to know why the Exergen Temporal Scanner Thermometer is the best for you and your family, just ask doctors and nurses why they use it at work and at home, and they'll tell you. The Exergen Temporal Scanner Thermometer gives a fast, accurate reading with just a gentle forehead scan and is backed by more than 40 published medical studies. Those all add up to peace of mind that your family is using the best and a great value for the money. Get yours today at Costco and other fine retailers.
Hi, I'm Joan London, and if you're worried about your parent or a loved one living alone like I was, and you want reliable senior care information, then call A Place for Mom, the nation's largest senior living referral service. With one phone call, you'll get free information on assisted living, Alzheimer's care, nursing homes, even important financial information. It's a free service, so call now.
Call now, 800-460-3580, 800-460-3580.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning.
Good morning.
Yes,
So,
what a beautiful morning.
You know it is Saturday, August the 10th. Did you know
It is Saturday already?
Yes.
I mean, I'm open today.
That's right. You're open today, Dr. Mencia. And you have brought a guest with you, Sheldon Ramkisson, who is the actually one of the owners of Total Home Health. So you're full of surprises here.
Always serving the community.
And, you know, we've talked a lot about that, Dr. Mencia, because you started the new procedure and the new going to people's homes because you felt there was a great need to it.
There's an absolute great need for not only for the aging, a lot of young individuals that have strokes and are not able to go to see a doctor. And these people deserve the same treatment than you and I that can go and see a doctor whenever we need to.
Yeah, I think we talked about that, and I've shared that so often with my mother, who was, she couldn't get out of bed, and I couldn't get a doctor to go there, and finally had to pay somebody, begging him to come, and it was at that point that he knew that she should have been in hospice, but what did I know?
But there's a lot of people out there that they don't know, and they pay privately to have a doctor come and see the patient, and they pay privately to have a nurse, and they don't know that those services are provided by their insurance. It's nothing extra. It's something that you deserve, and it's there for you.
Well, but the whole point is we are finding so many people now who don't want to go to nursing homes. They want to be cared for at home, and I think that bringing Sheldon here... I don't want to go to a nursing home. No, neither do I. I don't want to do any of that. I want to be taken care of at home. And home health agencies such as Total Home Health, which Sheldon is an owner, probably is providing the very thing that we've been talking about. Sheldon, welcome to our show.
Thank you. Thanks for having me.
And, there are a lot of home health agencies out there. So tell us about Total Home Health.
Well, let me give you some numbers. In South Florida, there's over 1,000 home health agencies in the Tri-County area.
Wow.
They are all marketing the same services, and I believe that one thing that differentiates Total Home Health from the other competitors are we believe that our seniors deserve the right to age in place. We believe that they deserve the right to be treated by professionals that are direct employees of the home health agencies versus contracted employees. And primarily, they should be working under the guidance of the physician, keeping in communication with the physician well within 1 week, 2 weeks, 3 weeks of the admission. That's something at Total Home Health we pride ourselves on, together with being on an electronic medical record system where we have the opportunity to give our physicians the chance to log into our system to review the clinical notes that are being done on their own patients. That's something Dr. Mencia and I have spearheaded within Total to make sure that transparency is there for him to know every day what's going on with his patients.
Absolutely.
You want to know what's going on, Dr. Mencia?
Oh, absolutely.
I'm kidding you because, he wants to know who their mother is, their father is, their sister, what they're doing.
How the patient doing.
You go way overboard on that.
No, so, I tell you, from the clinical side, I have been so impressed with this company because we have taken some difficult cases, some wound that patients have come to us because they listen to us on the radio, they heard from somebody else, and they come to the center, to the geriatric center, and say, can you help us? And we put a team together, and we seen wound healed on those patients, and the satisfaction on the family and the patient. Say, oh my God, they were able to heal that wound for us,
which is very tough to do.
And I think the secret is the harmony between the nurses that Total assigned to my patient and my staff. So the nurse will do the treatment one day, then we come the next day, and we never overlapping on each other, but complementing each other. And the level of communication with this company has been so incredible that the outcome is peace of mind to the staff and the family and the patient, and good results with healthcare. And the objective of healthcare should be for people to age in place. You agree?
Correct.
So we have these people living in their facility, or they are living at home, they are living in a condominium, an apartment, a house, and we want them to stay there.
I want to tell you, we all use personal experiences to share just what you've been saying. When my mother was doing fairly well and she lived at a retirement community, that was fine. And then as she started to decrease in some of her cognitive abilities, and then we brought her actually to an apartment near our home and brought in home health. And it kept her going for 3.5 years because of the quality of this person who became her buddy, her friend, took her to the senior center. So I am so supportive of home health because that's really the secret that people, and the big problem, and you probably know this, both of you, is nobody wants anyone in their home. I don't need help. Isn't that the cry? But when a doctor, like Dr. Mencia, writes a prescription and says,
and tell the patient
tells them what it is, then they act differently. When the daughter says they want it, forget it. but what Dr. Mencia says, right?
Exactly.
And so that's a very important part of you. When do you advise someone to have it? Have home health aid. Have a home health aid.
With home care, I am very aggressive because I believe in prevention. So with something as simple as changing a blood pressure medication or changing a diabetic medication, any medication that you change, the objective is usually to bring down the blood pressure in the first case. In the second case, to normalize the sugar. But the risk that we take with a change is that we can lower the blood pressure too much and the patient can fall down. We can lower the sugar too much and the patient can go into a coma. So as we are making changes, I usually call home health to have them monitor that patient with minor changes as we try to normalize the parameter on that patient without running into any kind of problem. Because sometimes patients run into problems because of the change of medication. So those are the simple cases. The difficult cases could be a person with a wound, as we stated before, to do more aggressive treatment and do it at home. Also, if the patient have decompensated, a person that is walking without a cane or a walker and suddenly is holding to the wall to get around, it's time to get physical therapy to come in there, work with the patient one-on-one. And we can also set the patient to outpatient therapy. So we have those two options. But what I like to do usually is start with home physical therapy, where they get one-on-one training, stabilize the condition, and then if we need outpatient therapy, then follow up with outpatient therapy. And the objective is to avoid using a cane or using a walker or ending up prematurely in a wheelchair.
You know, it's funny, we before we started the show, and Sheldon and Dr. Mencia were both here, and we had our previous guest who was talking about having some surgery, and his big question was, and I heard you jump onto that, well, I'm not supposed to be driving home, and then when I do this, and what did you say, Sheldon?
Well,
so perfect.
It gave me an opportunity to mention or educate the last guest on the different services. You know, you have skilled care, which is provided by Total Home Health, and then you have private duty services, which is provided by Total Private. Private duty services is not necessarily prescribed under a physician's order. It is a service that can be purchased by an individual that needs to have that assistant with them to take them to the outpatient center, to stay with them if they're going to be hospitalized for any amount of time, to prevent the need for family members to come from out of state. You can always interview the caregivers that we have under the Total Private umbrella, and that way you get a chance to develop a relationship with them before the need actually arises. And those are the two different scopes that we have with Total Skilled Care, which is Total Home Health, Inc., which you have the registered nurses, the physical therapist, the occupational therapist, and the speech. And you have Total Private, which basically provides more of a concierge opportunity. So if you want something that isn't covered under the Medicare insurance company, or your long terms, this is what you can pay for out of pocket also.
But you were saying something to him about driving. Is something that simple about driving a person there and and then waiting for him, bringing him back. And sometimes people they think that they're very independent. Someone as vital as that gentleman who was here, but he's having some surgery, and it wouldn't hurt for him to have that day someone at home just to make sure, right? Isn't that what you would describe?
He's having sinus surgery, and it's a very bloody procedure. And when you finish, you cannot be driving. You need to have both hands on the steering wheel when you are driving. You are supposed to keep your head up when you go home, so it doesn't match. You cannot drive right after sinus surgery. So he would be a great candidate to say, I need a private person to come and drive me there, keep me
fix
company.
My dinner,
exactly. Make sure that I get home. And
his blood pressure could rise.
Correct.
And it wouldn't hurt to have someone like that, right? I mean, it's so simple.
He could get home and say, oh my God, I forgot to bring my Coumadin from the pharmacy. Can you go and pick that up for me? And I forgot to get dinner. Will you bring me dinner?
Yeah, I have seen in so many instances where people have really lived so much longer because they've had AIDS. For years it was interesting that this was a kind of a thing that only rich people could have. You know, they grew older and they had this person at their home in their mansion. But nowadays, and I know you're the best one to talk about this, Sheldon, people have long-term health care insurance or they have other ways to be able to pay for this, and it's stupid for them not to have someone to help them.
You know, it all comes back to your quality of life. And if you want to age in place and you want to stay in your condo or in your home longer, you need to find out what conveniences you can have covered under your insurance companies, under the decisions you made, you know, prior to being of the retirement age. Long-term insurance is one of the let's say, insurance opportunities where you can have these things provided for. You can have 4 to 8 hours, even up to 12 hours a day covered to help you cope with your day-to-day activities. Like you said, the pharmacy runs, to be able to keep your eye on your wife while you have to go out. Those are the things that, you know, we tend to take for granted, but it becomes more difficult as we age. And our main goal is improving quality of life and aging in place.
And some people, a lot of people, they think they always have to pay out of pocket, and that's not quite true. I mean, if you're a veteran, or, you know...
Aid and assistance. I just heard about that from the last gentleman.
Veteran, they will get, husband and wife will get around $2,000 a month to cover for private duty.
Correct.
To be taken care of. For a single individual, I think it's around 1,000 something.
1,000 or 1,200. Yeah.
And I guess what they could do is when they call your company, let me give that phone number out to help you here and help our listeners. Total Home Health. Their motto is, we treat you like family. That's just what Dr. Mencia says. 954-962-2133. That's 954-962-2133. And that's Total Home Health. So if someone calls you and they want to have, they don't know what they need, what do they do? You have someone that comes out and assesses their needs?
Correct. We, on the home health end, we have a free skilled nursing evaluation that we're able to offer to any and all seniors. This does not necessarily mean that it has to be under the guidance or an order of a physician. Once we get out there and we recognize there's something, we can communicate to the physician at that point. Many times the physician wasn't aware of what has happened with that patient.
Right.
And that immediately prevents the hospitalization visit, the 911 call. So that's something that, you know, on the skilled side, we have complete, you know, we believe in doing that model. And we, between our offices from Key West, Florida, which is where we have a physical location, to Tampa, and throughout the state of Texas, we thoroughly believe that what we're doing is helping our seniors age in place.
You know, Dr. Mencia, you've had a lot of stroke patients, you've had people with Parkinson's, and I noticed that they also offer speech therapy and occupational therapy, and I guess they do this at home, at also the home, or do they go somewhere to do this?
They go to the home and they do it at home with the patient. So.
And you know, enough people don't know about speech therapy, and I think that it is so good because people who now have diseases or problems, whether it's Parkinson's or whether it's Alzheimer's or something, where there are ways to help them be able to swallow and all, right?
Absolutely. And the problem is when you lose the ability to swallow properly, you are at very high risk of developing aspiration pneumonia. And that usually is not the next drug that is going to kill the patient, it's the aspiration pneumonia that is going to kill the patient or have a significant decline that they're going to end up in a nursing home. So having speech therapy there really early, right after the stroke, when the patient is at home. And then I usually do follow-up. I am always on top because there's always, as long as I see the opportunity of improvement on that patient, and I make sure that the speech therapy continue to come, and we get the occupational therapy to come in and try to help them with the environment in their own home, so that the environment don't become a danger. How can they fix the environment at home so that they can live there safely?
So it isn't really, when we think of home health, it isn't really someone coming and just making meals or helping them with their laundry or driving them.
No.
What you've just spoken about is extremely important because it really will keep someone surviving longer. But people don't say, oh, well, I need a speech therapist. They just don't. But you as a physician would recommend that.
Exactly.
And that's what I think is so important about what you do, Dr. Mencia. You really do look at that total person, don't you?
Absolutely. You have to look at the what we call the biopsychosocial aspect of any condition. So if a person have a stroke, biologically we know what happened in the brain with the stroke. Psychologically, we know that that person now might feel depressed, might feel incompetent because they are not the same person they used to be before. And sociologically, like Sheldon just said, well, what is the condition at home? And what can we do at home to make this person feel more comfortable living at home and maintain a high level of quality of life?
Yeah, that's right. And so, Sheldon, and some of the patients, just think back. I know that you're one of the owners, and you're not in people's homes, but you know what's coming through. What generally?
He's very active. Trust me.
So
that's why I like him. He's as involved as I seen any owner for any company. He's very, very involved.
Well, that's
good. And I tell you, one of the reasons I fell in love with this company is because when I first started using, I usually, I'm a lot of company. How many companies you say out there? 1,000?
1,000 just in South Florida.
Just South Florida. So they are always, they come to my office and I give them a chance. I give them a patient and I wait for the feedback, see how they do. And sometimes they will do something that you would not expect. And I remember one of my patients, this old Jewish man that he's like a father to me, because all his kids died. So he used to say, "You are my son, you are my son." So it got to a point that I spoke with his family and we had to put him in hospice. He was really declining. It's 102. He's still alive. He's still going. But he's 102 and he was declining. And when I first started working with the company about 2 years ago, he just hit 100. And the family decided, let's go ahead and try to put him on hospice. I said, okay, but I'm staying in the case. I'm not dropping. Because this guy is like my father. So I said, I'm not dropping. So I told Total Home Health, I said, the patient is going to go into hospice. So we had to switch company to a hospice company. And a month or two later, I get a call from the nurse that was seeing him because she went to visit the patient. And she said, oh, he's doing okay. And, he was talking to me. I say, why did you go there? And she said, oh, I've been continuing to go just because, we established care with him and we know he's in hospice. We are not getting paid, but just to keep the social aspect of care,
amazing.
I just stop by there and say hi to him.
Yeah, you don't, that's right. That really, and because people that listening, Dr. Mencia, don't understand that when you have to go into hospice, Medicare does not pay your physician anymore. It's a whole
nobody
new procedure.
Want to see you.
Exactly. And that's why this is a very big point you made. I want people to really understand what happened here. Dr. Mencia still feels that you're a human being and you were his patient, and he still wants to watch over you. And now I just heard that Sheldon's company, Total Home Health, was doing the same thing. That really shows dedication, and I understand why you were impressed, because you don't get paid and you have to pay these people, and some of them do it on their own.
They do
the nurses, even if you're not paying them, they do it because they have such compassion for this.
That's the word, compassion.
And those patients that have decompensated that end up in the hospital, they do go to the hospital. They still visit. They are not getting paid for that, because now the patient is in the hospital. But they still go, they visit the patient. At least they reassure the patient, And they will trust the nurse and say, will you go to the house, make sure the lights are off? Will you do this, make sure I turn off the TV before and that service, that's the social aspect that you don't get out there, and you will have to pay to get from somebody else.
Sheldon, I do have a question that I've always wondered about. Let's say that you have a patient, and let's just say for all intents and purposes, it's a female, the wife, and you're there to help her. Now all of a sudden you see that the husband is kind of failing. He needs his breakfast. He needs this and that. How does that work? Do you bring in another person? What happens in that instance?
It happens a lot more frequent than you would even imagine. Okay, we have patients, that are home care has been ordered for specifically one of the spouses, the husband or wife. And within the first or second visit, the spouse recognizes what is being rendered from the clinician to that spouse. And they immediately ask, well, why am I not receiving that? I am no different from my wife or from my husband. We take it upon ourselves at that point to find out who the primary care physician is. Contact that primary and let him know, first of all, who ordered us to be in the home, which is a physician, and then what we have recognized with the spouse. And before you know it, it happens where we find out that two family members need the services of home care, and they're receiving it, which is preventing one from becoming depressed, which is preventing the other one from having a reason to be hospitalized. It works. I mean, there's no way that, you can sit back and say that home care is not helping to improve the quality of life of our seniors. And then from a service perspective, like Dr. Mencia said, with the amount of competitors or home health providers there are in the area, and over 12,000 in the nation, just so you know, there must be something that sets us apart from the rest of companies. There are 5 publicly traded companies, and the rest are all privately owned. Between myself and my partner, Alain Hernandez, we believe that what we're doing is cutting edge in home care. We are treating patients like individuals and family members. And they're not just a Social Security number or a Medicare number. To us, and Dr. Mencia knows, I do home visits. I will visit my patients to find out if there was a problem. I give my cell phone number out to the clinicians to give to the patients. I want to know the good and the bad, because this is the only way that we can definitely set ourselves different from the other providers in the area. And I think it's been working.
Oh, yeah. On occasion, I have called the company and say, I'm having a problem. I want this patient, or this patient is not satisfied. He or she was expecting X, Y, and Z, and you guys didn't meet her expectation. And lo and behold, I have Sheldon on the on the phone calling me and say, Dr. Mencia, don't worry about it. It will be taken care of. And
that you never get that. You never get that. You'd have to call, and then someone's going to call you back, and they never call you back. That's a wonderful thing.
Why don't you talk about the social worker?
Well, before you do it, let me give a number for those people who are looking for. Oh, we'll do yours first. Okay, we'll do Dr. Mencia's first. Remember, they're open on Saturday, and he'd love to see you. Home visits. Dr. Andy Mencia, and the phone number is 954-489-1345. Again, that's 954-489-1345. And
don't forget the website. Don't forget the website.
The website. Okay. I'm just adultgeriatrics.com. Adultgeriatrics.com is their website. If you could spell geriatrics, I'll help you here. Adult Geriatrics. GERAIATRICS. Adultgeriatrics.com. Let me just give you a phone number now for the Total Home Health. I'll give you the one they have a lot of offices in Dade and Palm Beach County and Broward, but I'll give you the Broward number. It's 954-962-2133. Remember, this is Pencil Talk Radio, so get your pencils, get your notebook, write this number down. It's 954-962-2133. Okay, so what you were asking.
About the social worker.
Go ahead. Yeah. Talk about the social worker.
So in the last, let's say, 5 years, we've recognized that a lot of seniors have not been receiving the whole spectrum of information as far as to where to allocate their Medicare. One of these services is through the social worker going to their homes to educate them. This is a free service that Total Home Health provides, even and up to going to the physician's office and meeting with the patients that have given up their Medicare benefit to go over to be converted to a managed Medicare. And from there, Dr. Mencia, I'm going to turn it over to you, because you've seen this happen where, your patients have lost the opportunity.
A lot of time is taken away from them.
Exactly.
I have so many patients of mine that say, oh my God, now I have this new insurance.
And they're proud of it.
and no, they are confused. They say, I have this new insurance. I don't know what to do. Now they say that you don't even take this insurance. So I will say, well, how did you end up with insurance? Oh, I don't know. Somebody called me and asked me a few questions, and I have no idea that I was signing up, and now I have been signed up with the insurance. So sometimes my staff will go ahead and make a call to the insurance and say, you have acted illegally, because the patient is very competent of making their decision, and they want you to immediately put them back on the insurance they had before. And if we are not successful, then the social worker will come in, and she will know better than I can how to follow through the pathway of reinstating the patient back with what they want to be.
Dr. Mencia, that's an excellent point, because the first thing people should be asking is, does my doctor come into your plan?
Correct.
That's number one. Because people, especially with you, that they wouldn't want to be taken away from you at all. So it's very important.
There are so many tricks people are using out there that we can do a whole program just on that. There are people that tell you, if you have back problem, go into this website or call this number, and we have a free patch we're going to give you. So because something is free, you get hundreds upon hundreds of people that either go on the website to fill out a questionnaire, or they start on the phone answering questions.